Hello, my name is Arthur Bienvenu, and today we're going to talk about tracheostomy cleaning. First off, you want to make sure and compare your physician's orders to the procedure card or the order, making sure that this is ordered for this patient as well. So before interim, you want to make sure that this procedure is for this patient. Upon walking into the patient's room, you need to make sure that this is the correct patient, so you need to do your identifications, comparing it to their wristbands, getting the patient to state their first and last name, and their date of birth. This is a safety check to make sure that this patient is who they say they are. Once we figured out that this is the correct patient, this patient does need to have their trach cleaned. You need to prepare your trach kit. It is a sterile procedure, so you need to set up a sterile field. Always maintain a sterile field above waist. Never turn your back on it. So in this motion here, it's going to be here to here, never this here. And also setting up the sterile field, you want to make sure wipe it open away from you, not touching the outside edges of the sterile field, because then it'll be contaminated. For the purpose of the video, we will use normal saline and peroxide, which is this here, but I don't have peroxide, but the Starbucks cup's going to work for that. So the next thing is we're going to start. So I'll put it away from you. The top piece is going to be your sterile field, touching just the outside of it, like this here. You want to make sure, slide your kit over, right? And touching the outside areas, you put your field down, right? So you have your field here. And you can move things around. You just don't want to contaminate the middle of it, right? So you touch the outside areas. This piece here, you can basically take it and dump it, making sure that everything falls dead in the center. Okay. And if you gotta wiggle it a little bit, making sure that everything is inside of it. Okay. Now, this here, we're going to set aside right here. Okay, the next thing we're going to do is we're going to take our peroxide, and we're going to fill up this area here, the end you're carrying on, just soak in there. Okay, so once we have the sterile field set up, you don't want to turn your back on it, but for video purpose, I want to talk to you, so I will kind of like look directly at you. Peroxide is poured in there. The kit is set up. Also, another important thing I want to talk about, I didn't show you, but if it's a new container or used, you want to make sure, and they call it the lip procedure, basically you want to rinse off the edges, so you kind of twirl it around and make sure that it all comes out first, and then pour the content into the container prior. So that's important to make sure that it's clean when you're rinsing it off, so there's not bacteria sitting on the edges, and you go directly pour it straight in there. And the bacteria is back in your cup or your little kit over here, so make sure that you lip it before, and that's everything. Then the next step is you want to make sure you have all your correct PPEs. For the purpose of the videos, I don't have a I don't have a gown, but the required things would be a gown, mask with the splash, as well as clean gloves. I do have splash mask and the gloves. Purpose video, I'm not going to put that on just because it's really warm in here today, but you're going to make sure and in the hospital setting, you make sure you have that on. So wash your hands and put on your clean gloves. This next step is we are going to release the inner cannula, which is this piece here. Everything should be tied off and visibly, everything should look tied off. And if you're just, when you're walking in the room, you're making sure you're looking at your patients. Obviously, we just kind of transition this really fast, but you want to really introduce yourself to your patient, check their armband like we talked about earlier, but just let them know what's going on. You don't just jump in and go straight to their throat and just go pulling things out, because you need to let your patient know what you're going to be doing today, just so they feel more comfortable and just a part of the treatment. I find it insulting if you go in a patient's room and don't say anything and don't even acknowledge that they're there, and you just perform a task, I don't feel like that's the best way to approach it. And anyhow, so now that I have clean gloves on, tell my patient what I'm doing. Today we're going to perform a tracheostomy cleaning. I know you, so just introduce all that jazz there. So we're going to cut straight to the chase. Holding your fingers here, okay? With clean gloves, you want to take it and it's locked, so you should twist, okay? And it looks like it's already been removed. So for the video, you would take this out and you would put it in the peroxide, letting it soak, okay? Yeah, it's been removed already. Yeah, it's removed. There's usually another piece that comes out the top. You just twist it and pull it out, put it in the peroxide, allow it to soak. It's usually like a twist motion. So you just unlock it, and then it's kind of like a I guess a U kind of deal, or just like this here curve. So you want to kind of go with the curvature. You don't want to just pull straight out, because then obviously it's going to pull straight out. So you just kind of go with the flow of the curvature of the unit. Once that's soaking in there, you can then obviously look at your dressings, the sponge dressing. If it needs to be clean, you can go ahead and just take this out, but making sure that these are still tied off. So I'm just going to, for the purpose, I'm just going to pull this out. Say it's visibly soiled. With your clean gloves, just kind of toss it in the trash. Your next deal is you want to, so it's soaking. You have this removed, and then as I'm doing this whole step, you want to make sure and look at your patient, make sure that they look oxygenated, that they're able to just to look like they're perfusing, because we're messing with their airway here. If there's a problem, then your patient will be the first to let you know, obviously, if there's a oxygenation problem taking place. So we're going to remove our gloves now at this point here, and we're going to move to the sterile part of it. So clean gloves, we're going to wash our hands, okay? The next part is we're going to don sterile gloves now. So let's see. Get my sterile gloves. You can't see in the video, but I'm donning sterile gloves. At this point here, let's put my gloves on. Let's put an extra large hand into a medium, and we'll get on with the video. And for the purpose of this video, I am touching the front of the gloves. You do not want to do that, but like I said, I'm putting medium into an extra large. So you want to make sure when donning sterile gloves, you usually only touch the part that's folded down. You want to be able to move it around. Once you get both gloves on, you can really take both sterile hands. If they both, hold on, let me show you. If they're both gloves is on like this here, the bulk of it on, the majority of it, at that point, like say if you got your hands like here, it's still kind of tight. If both hands have been put on properly, then you can come around and obviously move the gloves here and get it to fit you correctly. But you never want to do this part if your hands were your bare hands and then try to touch this area, because then it's not sterile obviously anymore. So, for the purpose of the video, just to speed things up, I did touch the front, but it's not the correct way. But for the video, make it go faster. That's what we're going to do. Now, this part here, you have your cannula soaking over there. You got a few different tools, okay? There's a brush, there is a cotton swab, and there's like a pipe cleaner deal. You also have the little box that you would pour saline into. I poured it into the clear container over here, which is still sterile. So so now at this point here, you have your cannula, and so sterile hands now. I can touch my sterile field. Sterile is fine, but just remember, never turn your back, and always love your waist. So I have the cannula sitting in the peroxide. We're gonna take this here, this brush. Can you see the video? Yeah. So you're gonna clean the insides of it. You can clean the outsides of it. Clean it very thoroughly, okay? Making sure that you get all like debris, if there's any kind of just caked on things or any just debris. We're gonna make sure and clean it very thoroughly to make sure that it doesn't have any airway blockages, because that is the patient's airway. So we're cleaning it thoroughly, going through, back and forth, cleaning around the edges. Now, once it's thoroughly clean, we have this here. This is no longer needed. So we're going to toss it. We're going to put it in the trash. Okay, put it in the trash over here. Now, we're going to take that cannula and we're going to put it in the sterile water, or sterile saline, excuse me. And allow it to be, rinse all the peroxides off of it and make sure that it's clean properly, okay? The next thing is, you don't want to put the cannula that has saline all over it back in here, because then you're going to have the potential for moisture and things to build up, and aspiration, you don't want to cause pneumonia, none of that stuff. So basically now we're going to take these pipe cleaners and we're going to take the cannula to the best of our ability, making sure that there's no moisture in and out, take it, throw it away. You got 3 of them in here, enough to make sure there's no moisture in it. Once you're done with them though, toss them. Obviously don't take the dirty one, throw it back on your sterile field because it's contaminated. So make sure that all of your equipment has the moisture been taken out of it, and as you're done with each piece, you get rid of it, okay? So just toss your trash. The next thing is we're going to take the cannula that's dry from here, and we're going to come and we're going to put it back in the patient now. The patient still has neck ties tied down, but anytime they cough or gasp for air or any kind of just pressure, and anytime this here can fly straight out. So we don't want to make sure that to always keep these tied down. Okay, even when we're changing straps, we always want to have our hand held here anytime it's untied, because that's the patient airway, and if it flies out, the patient doesn't have an airway anymore. So we got to maintain that patent airway at all times. So we have the inner cannula back in. We twist it in it now, so it's secure. Once that's back in, if the patient has, say, like really bad secretions on the side of it, okay, we can then take the saline, clean around with there's the Q-tips that comes in the kit. Okay, for the video, just to show you what I'm talking about, and just make one swipe here. There's a few of them. Take the saline, okay, clean around the side, another side, and you use one for one swipe, throw it away, get another one for the next side, swipe, throw it away, and you clean it around it. Now, there's also peroxide in this kit, like we talked about earlier, for really bad secretions or really heavy secretions that's not coming off with just saline. So if it's heavy secretions, use the peroxide to definitely clean that area. Now, if the dressing, let's see, this dressing, at this point here, the dressing's bad. Earlier, we were talking about it was just a gauze dressing. Now, this one here, if this one's soiled, at this moment now, you can change it. So you slide this one with the slit in it out, and obviously, if it is dirty, we're just gonna tell them, just hold on 1 second, a little discomfort, and just kind of go in and go up, okay, and making sure that you do not dislodge the trait. So here, I would trim this piece here a little bit, just because it's so big and bulky. Not that it's too small, don't make it too small, but this is kind of large here. So you can tape it around the edges, okay. Don't make sure that it's not taped to the patient's throat where it's discomforting. Also at this point, if the ties, these guys need to be changed. If you see secretions on them, definitely go ahead and change them. If they don't look like they need to be changed, you don't necessarily have to change them unless they look visibly soiled. But again, the main deal with the ties is to make sure that at all times, hold one hand. You can take your hands like this, like a piece, hold it on it. Not that you're pushing a lot of pressure, but just maintaining that cannula or that trach is not really going to move. You're just going to hold it there like this and undo one side, hold your fingers, take it around with the patient's room, have your next one, come tie one side, and then go around and tie it. Making sure that in case they go to cough, it doesn't come out like we talked about earlier. Um, at that point there, the whole trach has been cleaned. We clean the inside of the cannula. We change this gauze here. We've changed the ties if need be, if secretions are heavy. We've also cleaned around the stoma part of it, I guess, or the opening of the wound, or not necessarily the wound, but just the opening there. Um, Again, with saline, and if it's heavily has heavy secretions, you can definitely use peroxide. Make sure that you document all of these different steps. Say that you walked in, the patient had some kind of respiratory distress or uneasiness. Make sure that there's all these throughout the steps, throughout the whole throughout the whole procedure, that you're documenting if there was any signs of something that the physician should know, or the future nurses should know. That if the patient halfway through started gasping for air, or if it really just tired them out, make sure that we document the color. If there was any foul odors, make sure that everything that we performed and we visibly seen is documented in the chart. And after this point here, everything has been completed. You can definitely remove your gloves. Make sure you wash your hands, remove all your PPEs. But that is trach cleaning. And make sure that you pay close attention to your needs of your patient, because they are the best ones to tell you what's taking place, and if they are any discomfort, they will definitely let you know. They're the best indicator. Thank you so much for watching. That is it.